to another Wednesday, Monday webinar. My name is Dr. Ken Stewart, and today we're continuing our four-part series. Currently, we're in part two, venturing out with COVID-19, staying safe. And before we get started, I just want to give a commercial break and to let you know all of our webinars are on our YouTube channel, Epic Health Education. So please feel free during your time, during any opportunity you may have, to go check out our YouTube channel, and you can find over 70 different types of webinars on various topics. Okay, without any further ado, let's get started on part two. I just want to highlight some of the recommendations that we were told as we venture out. One is to keep at least 6 feet distance from other people. Want to make sure you wear a mask that covers your mouth and that covers your nose. Every time you go out, you also need to wash your hands before, during, and also after, if at all possible. Well, during, and there might be a situation where you may not be able to do that, but make sure you come home and wash your hands. And lastly, don't go out if you're sick. Don't go out if you feel sick. So moving forward to today, we're going to be focusing on venturing out with COVID-19 when you want to go get your hair done, when you want to get a haircut. It's impossible to keep 6 feet of distance from a hairstylist or a nail technician. So consider that before you go. That already puts you and the employee at a high risk, being in close quarters. So what you can do, you can check out the safety protocols, and questions you may have in your mind is, are the workstations at the salon or barbershop properly distanced? Are employees wearing masks or face shields, gloves, and smocks? Do they disinfect tools in between clients? Are employees regularly screened for symptoms? So those are some of the questions you want to have in mind, but also want to check out the protocols. I just recently got an email or a text message from my barber stating what his protocols will be as he opens up his barbershop next week. So you want to be mindful of what they're doing and how you can protect yourself as you go and get a haircut, or as you go get your hair done, or as you go get a massage, or as you go and get a manicure and pedicure. Number 2, wait outside. While you wait for your appointment, sit outside. Distance from other people until it's safe to enter, or request that they contact you when they're ready to go, or ready for you, sorry. I'm not too sure if this is happening, but one idea that I would recommend if I was talking to my barber is to invest in those devices that shake when various restaurants would give you, when you come in, they would have you write your name, and then they would give you some type of machine that vibrates when it's your turn to be seated. So you could be outside, relaxing in fresh air, in your car, and let's say your time is up to go get your haircut or go get your hair done. That device can vibrate, letting you know that your hairstylist is ready for you. So that's one option that they can consider. And lastly, submit to a temperature screening. In certain states where salons were permitted to reopen, businesses are encouraged to use a touchless thermometer to screen customers. Anyone with a temperature over 90 degrees or based on CDC recommendations will not be serviced. So you want to be careful. You want to make sure that you are not sick when you go out. You want to make sure you have your mask on. You want to also, when you go to the salon, check your safety protocols, wait outside, and submit to a temperature screening. Ride share and public transportation. This is very important because a lot of people ride the bus, ride the train, ride the metro, and they're in close quarters. So if somebody coughs or somebody breathes, that you can be at an increased risk. So you want to ask yourself, before you go out to ride, do I absolutely need to use this service for an essential task? Will I take it to visit an essential location? If the answer is no, do not go. Here are some options to consider. Consider alternatives. Reserve public transportation for the people who have to take it, like essential workers. If you don't need it, consider alternative means of transport like walking, biking, or taking your own car if you have one. Number two, look at peak hours. If you're someone who must use public transportation, it's recommended that you suggest looking into service peak hours. If there are fewer people at a certain time, try to hitch a ride at that time. Lastly, watch what you touch. On the train, on the bus, watch what you touch. If you have gloves, that's even better. But with the gloves, make sure you take off the gloves at the appropriate time before you touch the door of your house or your keys, or as soon as you come in, you take it off. But gloves are very important too. Watch what you touch and be mindful of every surface you touch. You may need to hold a handrail or shut a car door, but be careful not to touch your face with your hands before you've washed them. So just a quick recap: ride share, public transportation, consider alternatives, look at peak hours, and watch what you touch. And this brings us to the end of part 2 of a 4-part series entitled Venturing Out with COVID-19. Please be safe, please be careful, and make sure you have your mask on when you go out. And stay tuned for part 3 on venturing out to the clinics, venturing out to the airport, and venturing out to polling places. Thank you. Have a good day. Bye.